Thank you for joining us, Attilio. One of the reasons why I was so keen to have a word with you today was because, of course, not only are you a full-time acupuncturist, but you've also shaped the profession by your contribution to the Chinese Medicine Times. So I really wanted to learn a little bit more about the person behind not only that clinical work, but obviously a vision for the profession as well. So could you tell me a little bit more about how you came to discover Chinese medicine?
I was backpacking around Asia for a year and I had a lot of time to think, what did I want to do? And yeah, after spending hours and hours on trains and buses traveling around India, I wanted to do something that was giving back to people, giving back to society, that felt very rewarding. And I was going to study Ayurvedic medicine, but after spending 5 months in India, I was quite ill, lost a lot of weight, and I thought spending 5 years in India would probably kill me. So I started to get into Chinese medicine. My mother started the degree a year before, and my brother also went in and studied as well. So it's actually a family of practitioners. I'm not sure if you know that. So we all practice Chinese medicine. We all study at the same university, and we all have our own clinics.
And so that's really interesting. That would have, I mean, in terms of a buddy system as you were studying, have you all gone on to work in different areas of Chinese medicine, or are you similar in your outlook?
Similar interests. I mean, most acupuncturists nowadays tend to treat, general things, but then concentrate more on pain and fertility. Seems to be the strong points of acupuncture at the moment. My brother has his own clinic in the City of London. My mother has her own clinic in Kent, and I have my own clinic in Berkshire.
And are you finding, given that you're working in different uh, regions, are you all seeing similar things?
Yes, it is pretty similar. We all similar things, similar problems, similar outlooks, similar ways of building up the practice, all similar problems. Yes, sure.
And so tell me about some of the challenges when you were studying then. I'm really curious to know whether they've changed, do you think, for the profession or whether they're the same for students.
Well, there's the challenges that we had during studying was just the amount of work we had to do. I mean, there's different degrees and there's different educational levels. That's what a lot of the public aren't aware of. So most acupuncturists just do 3 years part-time. Mine was a 5-year full-time degree because of the acupuncture and the herbs and a lot of Western medicine. So it was mirroring the actual degree program in Beijing University. So it was very intensive. It was just the lack of time, really, just spending all my time studying. It covered a lot, but it was a basic. It was enough to get you by, basically. When you graduated, you had enough, but it doesn't. Nothing prepares you fully. You need experience. You need years and years of clinical experience to then build up your practice. But in terms of the failings of the course, I would say TCM and is predominantly herbal medicine based theory on top of acupuncture, which isn't really acupuncture theory at all. So I was having to relearn and restudy acupuncture after the degree ended.
What are some of the differences, do you think, in terms of, understanding things from a herbal perspective versus understanding them from
Well,
perhaps an acupuncture meridian-based perspective?
herbal medicine is all Zhang Fu theory, where and that's applied onto acupuncture theory. So a lot of TCM is like a manual of acupuncture is lots of cookbook approaches. This point does that, and but in clinical acupuncture is a lot different. It's a lot more channel based. Um, the mirroring system of acupuncture, which isn't really explained much. The Ba Gua, the I Ching acupuncture theory, which is laid down in the Neijing, isn't really taught much today. So we have to go back and do postgraduate courses such as the Master Tang and Doctor Tang classes.
And what sort of gems have you learnt since graduating that you didn't find you picked up in college? I'm really curious to whether you can pass on to some of those to our viewers.
Really, it's the Doctor Tang and Master Tang courses I've done recently, which has given me a whole new breath of fresh air into acupuncture theory, which I didn't learn at uni, which most people don't learn at uni, unfortunately. I don't know why it's not on the curriculum.
Hmm. And certainly so that idea of the balancing and the mirroring. What's been
Mm,
your, as you say that the Bagua isn't really taught at university. How do you apply
mm.
that in your clinical practice?
Well, Bagua is all about mirroring, and Bagua is a big concept theory. I mean, life is a big mirror. Everything that comes towards you is a mirror, and you're looking at the reflection and trying to understand what life is trying to teach you. And that again is applied in the human body. So if you have a problem with your knee, then you treat the opposite elbow. It's that application of mirroring theory, which the Chinese have discovered so long ago.
And how's that changed your clinical practice then? You say that this has been a fairly recent discovery.
Yes, it's courses I've been doing this year. My brother did it a few years ago and found it very helpful. And he practiced that mainly now in his practice in the city of London. It allows me to, it's a different toolboxes. Rather than just having TCM, which is one system of protocol, you've now got 3 or 4 different types of protocol, which you can apply to different situations depending on the problem that you're treating.
I'm curious then, so what makes you decide which theory to apply? How do you make that decision?
That's a very good question. That again is based on clinical understanding, experience, perspective, what you think might be best for the patient at the time.
Interesting. And can you give a recent example of where you've had to sit there and almost flick through your mental portfolio of treatment options? And
Um,
do you
yeah,
change them as you go along, or from the moment somebody walks in, you know which avenue you're going to go down?
yeah. It depends on the condition that you want to treat. If it's more pain, then it'll be more Dr. Tang and Master Tung. If it's fertility, it can be a bit of both with TCM and Dr. Tang's global balancing hormone system. Um, post pregnancy, I tend to do more TCM, and pre-birth tends to be more TCM. Might be with some induction. I might do a bit of TCM with Master Tongue thrown in there as well.
How interesting. And now that's interesting because that you've referred specifically to acupuncture. At what point do you then look at herbs in combination with your treatments?
Well, I love herbs, and I wish more patients would take more herbs, but it tends to be a strong acupuncture following in this country. And as you know, in China, it's herbs first, acupuncture second. In this country, it's the opposite. So where I can, I'll try and give herbs. Of course, herbs don't taste nice. Patients don't like to take it. They don't understand the herbs. They hear more about acupuncture. There's more research about acupuncture. So patients are more prone to go towards acupuncture. But if you can steer them towards herbs. Again, it depends on the patient. If they're older and the problem's more chronic, then I like to use herbs as well. If they're younger, you can bounce back. It's easy for them to bounce back with dietary advice as well as acupuncture.
And how much do you use dietary advice then? Is that something you've done extra training in, or that was part of the course that you did?
That was part of the course, and I give it out to every patient.
Oh, no, that's interesting. And you have a formula, do you, or how do you apply dietary
There's
therapy?
different, yeah, I mean, you do the diagnosis, so it's blood deficiency, yin deficiency, then you'll give a dietary advice based on that diagnosis.
Indeed.
So it's about empowering the patient, so it's teamwork. We help each other. I help them and they help me, so I can make the treatment quicker and more effective.
And how compliant do you find people are? That seems to be one of the biggest challenges, is actually making sure that people follow through with some of the advice we provide.
Generally, they are very compliant. When it comes to things like alcohol or coffee, then they're maybe not so compliant, but they can see the logic. I mean, when they come in, they say what their problem is. I'll do the full consultation, break down what's going on, explaining it to them. It's the explaining that's very important. It's empowering them the knowledge of Chinese medicine so they can see how it's working, and then you can get them more on board to do the dietary advice and the lifestyle advice as well.
Well, one of the things that recently came up at our Impact Symposium was how important communication is. That's communicating with your patients,
Mm.
communicating with other health professionals, and communicating with greater, policy makers. So, with that communicating you're doing directly with the patients, do you use the acupuncture vernacular and talk about elements and organs, or do you translate that for patients into a language that's perhaps more Western medicine focused?
A bit of both, yes, a bit of both. I try to marry the two together. So I might talk about blood deficiency, which is an obvious one because people understand anemia in Western medicine. I tried to explain the concepts of yin and yang and people having a yin deficiency or excessive yang and why that's going on and what dietary influences are affecting that, or stress or emotional influences are affecting that. So yes, it's a lot of Chinese medicine in there with a bit of Western medicine as well.
Interesting. And do you have much experience, in terms of obviously running a busy practice, your time is spent with patients. Do you have much contact with other Western medical health providers?
Not really, no. We tend to be pretty segregated from Western medicine establishment. Having said that, I do treat lots of doctors and nurses who come to me for their own problems, but apart from that, no, there's no connection as such with the National Health Service.
Because one of the things, again, that came up at Impact is that idea of communicating with other health professionals with a view of establishing acupuncture. How do you feel that? How does that fit with your practice?
I think it's a great idea. It's a great concept. I've tried it before. I've sent out letters to GPs saying I'm treating their patients, and honestly, they don't really, in my opinion, they don't really want to know, and they can't really recommend it in their own practice because it's a private form of healthcare that's separate to them. So they can say maybe yes, acupuncture is okay, or yes, I don't think it's caused any problems, and that's about it.
How do you see acupuncture as a profession growing towards, an idea of integrative medicine? Do you think that that's going to work, or it's possible? Or how do you see
I
acupuncture
think
fitting in the future?
I think it's already happening in a way with lots of physios doing acupuncture and some GPs offering it as well, and some availability on NHS. It is slowly going that way. Um, but full integration, I think that will come later with time. Yes, but the herbs, I don't see that happening for a long time.
And you've hit on a very sensitive subject, that the idea of
Mm,
physiotherapists and other health professionals performing what we'll call acupuncture type techniques. It's sometimes known as dry needling. What are
yeah.
your views on that?
Mm. I mean, most physios do acupuncture after a weekend course. I mean, really, it's not acupuncture, and a lot of patients come to me saying, "Oh, they've had acupuncture through their physio." It's disheartening because that's not real acupuncture. I mean, saying, "Oh, it's painful there," and sticking a needle in it isn't really acupuncture at all. Dry needling. What is dry needling? Without any theory or history behind it, really, from my view, it's just stabbing people with sharp objects.
And do you think there's a perception amongst traditional acupuncturists that there is a threat that we will be taken over by that? Is that your view as well? How do you feel in
Yes,
terms of positioning?
yes, it is. It is a threat. It's people muscling in, as it were, on an ancient industry which is a lot more complex than people understand. So yes, it's people giving a wrong idea of what acupuncture is, and it does taint our reputation and our name.
And how do we protect ourselves then? What would be your advice?
Regulation, regulation. We need regulation like it is in Australia, with regulation, statutory regulation of acupuncture and herbs. But I don't see that coming in this country for a long time.
No, I'm going to. I've obviously been asking you lots of questions about being a practitioner, but I'm curious to know your perspective too, from having worked on the Chinese Medicine Times and just wanting to find out your motivation for setting that up, and some of the things that you learnt from sitting in that sort of bird's eye position and having an umbrella perspective of the profession.
The motivations really was seeing how information was becoming more instant and more online and easily accessible, and I'm wanting to further promote the Chinese medicine cause by offering free articles online to anyone that really wanted to read it. Um, the software was bought before JCM relaunched their new website because I think there is a kind of similarity between JCM and CMT, which wasn't intentional, it just happened to work out that way.
And so I guess that idea of educating other acupuncturists and keeping acupuncturists up to date. But what role do you think there is in terms of educating the general public, and seeing that there's a bit of a lack of understanding of what acupuncture is, if people are misconstruing that physiotherapists are doing acupuncture if they're sticking pins in?
There is a lot of education of the public that's still needed, and if it's not up to the government to bring in regulation, it's up to practitioners themselves to try and educate the public as into the differences. Yes, and there are quite a few differences between physio and dry needling and what is termed traditional acupuncture. But even then, we've still got the concept of what is traditional acupuncture. Is it TCM and five element, which is relatively born out of the last 40, 50 years, or is it Bar Gua mirroring systems that are thousands of years old? What is traditional?
Mm. Indeed, I think that's part of the challenge is how do you regulate a profession which actually isn't a homogenous group. It's a made up
Mm,
of lots of different people and lots of different ideas. So what do you see the
mm.
future of acupuncture in the UK and around the world?
Uh, That's a good question. I would like to see it go away of Australia, but how do I see it? I see it going the current way it is for many years until people become more aware of acupuncture and more knowledgeable of the different types. And I'm afraid there might be through a few horror stories where physios have left needles in by mistake, I believe there are already. And until that time comes, we'll be in the same path.
Mm. And so, do you feel optimistic that after perhaps a bleak period where there's going to be confusion around what different people have to offer, that there's a role for acupuncturists within, say, the public healthcare system, or one of the things which comes to mind, of course, is where across the world, Australia and the UK and the United States, in Western world, we're facing a major global health crisis with the ageing population and realizing
Mm,
our public health care infrastructure is not set up to deal with people living longer and people surviving conditions that previously that might have been caused high mortality rates. So we've got an aging population and a declining healthcare system, and that
mm.
there's is there an opportunity there that acupuncture can actually come in as a primary healthcare system rather than a secondary or tertiary, which it currently is?
I think that is hopeful. I think, yes, it offers a cheaper form of healthcare, primary healthcare, in conjunction with the escalating cost of pharmaceutical drugs, as well as the side effects of pharmaceutical drugs. Not to mention that lots of antibiotics are going to be redundant in future years. So I think there will be a gap there for acupuncture and, more importantly, herbs as well to fill that need for primary healthcare. Yes.
Yeah, I'm just going to change course very quickly before we finish up and find out. You mentioned you were studying intensively in a 5-year course, and now you're working in a successful private practice. What had to happen in the meantime? How did you build up your business, and what would be your advice either to new graduates or to other acupuncturists which are sort of struggling to make that leap?
We all struggle, all of us, both myself, my brother, and my mother. It takes time. You just need to stick with it, have faith, and believe that you can be a successful practitioner. Set up in a place or a few places, work from 2, 3 different clinics, and stick it out. Yeah,
Mm.
and I think also lots of marketing and advertising is important. I think we tend to be so optimistic as students at university that, hey, this is great. We can just go out there and people are going to come to us, but it's just not like that. You need to do your own marketing. You need to have a business head on yourself, as well as being a caring and thoughtful practitioner.
So, what were some of the marketing strategies that you used? What did you find helpful in your practice?
Generally, for me, what works the best is online, Google. Things like leaflets or yellow pages is a bit redundant now. Everything is online. People want it, and when they want it, they go and search for it. If they search for it, they search online, and it's generally Google. So I think concentrating on your website presentation and presence and marketing is chiefly important.
Now, I'm really curious that you say that because more often than not, when I speak to practitioners, they're always saying word of mouth. Forget a website, hit the streets, go and network with other people in your local area. So I'm absolutely, it's enlightening to have you say that because you're one of the first practitioners that have said go straight to the internet because that's such a great source of referrals. So could you tell us a little bit more about some of those processes you set up? So you invested in a website at the outset, and of course your knowledge from Chinese Medicine Times would have been a really that would have been concurrently supportive of that initiative as well.
I think going out and giving talks is helpful and that can generate business, but at the end of the day, it's nowadays people want it and they want it now. And when they want it now, they go and search for it. That's the way human nature is at the moment. So yes, having a good website with lots of information, And also advertising, you need to maybe do Google AdWords advertising. To having a website isn't enough; it needs to be up there on the first page of Google. But yes, talks is good. I've done some talks recently with yoga classes and such, and it does help to bring in some patients. Um, Referrals are very important as well. Having a newsletter, sending out a newsletter to your client base is also very helpful, and to get the word out there to remind people of what you offer. But the first port of call, I think, is internet, and I know a lot of practitioners where I am do the same thing. They're aware that internet is the main source of influx of patients.
And I'm curious about your newsletter. So, how often do you put together a newsletter? What sort of articles do you find are important for people?
I tend to send out a newsletter every few months about the latest news topics that are coming up about acupuncture and herbs, based on different areas that I'm interested in. So yes, it's similar in some ways to CMT sending out that newsletter. It's just in a sort of smaller group of people in a different format, different layout.
And so that then leads me to ask how much communication do you have with your patients? Are you finding that that's an important way of retaining them into your practice and on your books? Is a fairly regular way of communicating with them?
It helps to jog their memory. I mean, when patients are in need, they will, some of them will come back to you, and some will forget about having acupuncture. It's about jogging their memory and getting to come back. But I do have patients that come back year after year looking to have similar problems solved, and then they're referring their friends and family. Yeah.
That seems to be the sound way of growing a business. Of course, is to once you've got a patient, make sure you keep them happy and foster that relationship. So, are there any other strategies that you use?
I mean, referrals are great, but in my area where I do a lot of fertility, people don't necessarily want to talk about their fertility problems to their friends and family. It's only when they start talking to their best friends, they start to hear, oh, they've had similar problems, or and that they've tried acupuncture. Have you thought about that? So people don't tend to talk about their health needs with their friends and family unless it's a general problem like an ache and pain. If it's fertility, it's more personal, so they don't tend to talk about it much.
That's interesting. So that in itself then confirms why something like the internet, where it's a private way of accessing information, might be more attractive to someone with something like a fertility problem. So if somebody was to be setting up a fertility type business, that the
Mm,
internet was a very strong place to advertise. Whereas again, perhaps aches and pains, where you do get a lot more word of mouth, and people are happier
mm.
about disclosing that. So you've really raised an
Yeah.
interesting point there, that perhaps people need to consider not about their acupuncture business, but the types of treatments they're performing as to where they might consider marketing.
Exactly. It's every health is a personal thing, and the internet is a great source of information. And I have lots of patients looking for amazing amounts of information on the internet. Unfortunately, not all of it is peer reviewed, so you need to cut out what's right and what's wrong. And there is too much information out there. But yes, it's certainly the first port of call that most patients go towards.
Yeah, no, that's brilliant. Well, listen, is there anything else that you'd like to add? I know you. We've spoken in the past about you being involved in the Impact Symposium, and wondering whether there are anything that came from that that you'd like to contribute to.
It was interesting because I think you brought up how long does it take to build up a client base. And I think for practitioners listening to this, it takes years. You need to sit there and wait and put the work in, the marketing work in, and be patient and work from a couple of clinics, and it will build up and you will be successful. It's not going to happen overnight. And the second poor thing is point is the regulation. There's not enough regulation. Chinese medicine tends to be very fragmented in this country, and we need to come together rather than fighting each other and pressure the politicians for statutory regulation.
And one of the things, as you know, that we're really passionate about with Acupuncture Professional is using technology to do that. The Impact
Mm,
Symposium was a great example of saying we can now, using this really easily accessible platforms, be able to bring
mm,
people together. So that's certainly something we're really hoping to do. And using some
yeah,
of those models in countries like Australia, where it has been regulated. New Zealand is a hot topic as to whether regulation should be introduced. So it's we're excited to have that opportunity as well.
yeah. I think people will need to start talking together and bridge and making those bridges and working together rather than fighting each other. I look forward to that.
Indeed. Well, listen, thank you so much for your time and thank you for sharing those gems
Thank you.
and certainly your enlightening contribution about looking at using the internet more for advertising. I think, as you say, the internet's going to become people's first port of call before they head to the GP. They'll be accessing information
Mm,
directly from there. So it's how we can then be at the forefront of their attention and get into that interface. So thank you again for your time.
great,
And
thank you.
we look forward to hearing more about your vision for regulation and helping practitioners get out there as well.
Okay, thank you very much.
Thanks.